meant for an adult audience. Loveline may contain sexually oriented content. Listener discretion is advised. Adam Carolla and Dr. Drew. Loveline, coast to coast.
Hey, everybody, it's Loveline. I'm Adam Carolla. That's Dr. Drew. Phone number 1-800-LOVE-191. Dr. Drew's a board-certified physician, addiction medicine specialist. Got to be in before the show begins. That's it.
Adam, you've already scared the young ladies enough. Introduce them, please.
Unacceptable. I'm just looking at the tape on the headphones over there, and Laura wants to know if they fit. If they don't fit, they're not. When I realize we don't have headphones, I can't stand this place anymore.
One size fits all. It's all good.
Mila Kunis and Laura Prepon are both here from That 70s Show. Tuesdays, Fox, 8 o'clock, 5th season, into syndication now. That's where the big money is, right?
Sure.
Yeah. Not as much as you'd think, but we're not complaining.
Now, why isn't it as much as I would think?
I don't know. You know, a lot of people when they hear about syndication, they're like, "Dude, you're making so much money." But but it's the residuals get less and less as they come. But
it's 3 years worth of decent money, and then after it's like 20 cents an episode.
Huh.
But we're not complaining though. It's
nice.
great.
It's very nice.
Yeah. Well, but like if you created the show or wrote the show or whatever,
then you get bank.
When you have points in the show and you're like a producer or something,
no,
you get bank.
We don't get points. Let's just point this out. If you have points in the show, like producers do and creators do, that's when the show goes into syndication with points. Then you're like made for life. But
right. Lean up on your mic a little bit there.
Okay.
Yeah, and then now you're on.
Every day it's a little scary.
2 times.
Now, did I'm sure you guys were both recognized quite a bit anyway, but did it go up a lot when you instead of spending a half hour?
The posters are like everywhere. Those bizarre posters with Kiss that don't really make sense.
But
like roller skating.
Rock and roll every night.
But that makes you guys kind of go like this. Does you notice that more people seem to be noticing you, or?
Yeah, now that we're syndicated, I've gotten it a lot.
Laura notices it. She's like, I don't know.
Well, people used to look at, like, in my case, people used to look at me and be like, is that her? But then when they hear me talk...
No, wait.
We were at
an Angels game, a couple days ago, and the guy goes up to her and goes, wow, you really look like the girl from the 70s show. And she's like, literally, this guy must have been drunk. And then we're both sitting there, and these people are taking pictures of us, like, outside drinking water or something. This guy's like, you guys really look like the girls from that 70s show. And I was like, really? You kind of sound like her, too. Really? All right, nice meeting you. Bye. Like, totally just left.
I was nice. You made it sound like I was mean.
No. She was very nice, but the guy was just, like, whacked out. But that was so funny.
Yeah, I guess as a woman, you have to worry about
all kinds of things.
Yeah. Guy following you home. I had the exact same thing happen at the Angels game.
Really? You kind of look like that guy.
That was a pitcher.
No, but I don't... You know...
The guy don't look like you.
Is that the thing in the pamphlet? You guys buy it? I was like, I don't know.
I don't get that guy. I get Adam Carolla. That's the thing that's interesting about not being on a sitcom. Right. The guy said, you look like Adam Carolla.
Right.
That's, all right. I hear it all the time. All right, so That 70s Show, going strong, 5th season.
Yeah.
And now into syndication, and instead of being on the air half-hour a week, you're on 2.5 hours a week, right?
That's right. My grandparents are very happy.
I think we've had every cast member of your program except the mom.
I don't know if Deborah Jo would want to do Loveline. I don't know if she's too into it.
You've had Kurtwood?
Yeah.
Yes.
Really?
Great. Yeah.
Yes.
He was great.
That I would love to listen to.
Yeah.
He was
Kurtwood's rad.
Papa 70s Show was in here 8 months ago.
Yeah, I don't think it was that long yet, but he was great.
I think you guys should get Deborah Jo. I think that'd be kind of fun.
It would be fun.
She, you'd be surprised, but she's kind of, feisty.
Sexy lady.
Yeah.
Drew's passionate man. Maybe
we'd get along great.
We'd have a look.
Oh, nice.
Ayla?
Yeah?
You're 17?
Yep.
What's up?
Well, I'm currently sexually active, but I can't have an orgasm. Even, when I, do it myself, I can't reach orgasm.
She's 17. Ladies?
Yeah.
Go ahead, Free. You take this one.
Did you take this one?
Laura's done this show before.
I figured.
I don't know. I'm a little...
Well, isn't there, a medical reason for some girls not being able to have an orgasm?
Most women under about 22 have difficulty.
There
most. So she's normal having difficulty. And very few would have orgasm during intercourse.
Well, maybe her boyfriend doesn't know what he's doing.
Oh, yeah, none.
But
zero.
But then she doesn't.
Less than zero. Drew, is there a number less than zero?
No, that's it's not. talking about probabilities. It's uncommon.
But even if she does it
So
herself,
in a couple years, then she'll have it happen.
It'll start. Her biology will start to sort of operate better. She'll start to figure out how things work, and it's a matter of really sort of paying attention and.
You're 17, but you know you may want to try the tub.
Mm-hmm.
How about that tub?
Okay.
You know what I'm talking about?
Yeah.
No.
You do or don't?
nice sound effects.
You know, use a little water action.
Yeah.
Waterfall.
The jacuzzi jets work.
Yeah, right. You've been there.
Jacuzzi jets do work for you.
Yeah.
Right.
All right.
So then what
She's
are you
17
talking about
and
then?
she knows. Oh my god.
Yeah.
So it has happened then.
But-
so
Well, she knows it kind of happens there.
Yeah.
Does she climax at all? Is there a climax, or she can't?
No.
Nothing.
No.
You have a boyfriend?
It's a hard concept for Mila to
No,
get.
not right now.
No, I'm not saying that.
Okay.
I'm just wondering if she can't just finish an orgasm, or if she kind of
Can't
gets.
have one. Can't
Wow.
have one.
All right. It'll come. Pardon the pun. And no boyfriend?
No, not right now.
All right. Sure. All right. Well, actually, maybe you need one more now. Actually.
Yeah.
You're
maybe.
fat. It might
True,
help.
please.
well, when guys are that young, I don't think they know what they're doing. I mean,
No.
you know.
No.
So in a
part of the
couple
problem.
years, it'll happen.
Yeah. Guys have a nice window. Like when they're young, they don't know what they're doing, and then when they get about our age,
They don't care.
We don't care. Right. So little window in here of about. For me,
So
it
when
was
you turn 20, start taking advantage of it.
I think my window was about 4.5 months. I think it was
Nice.
24 and a half
Oh,
to just
really?
before 25.
That
But,
young, huh?
that was my care window.
Impressive. Too bad you were
I
cleaning
was single
carpets.
during that time.
right.
Yeah. Mike,
Yes.
you're 43. What's up?
Hi, I was listening the other night, and I heard Adam say that he's an expert at receiving oral.
Oh my God.
Yes, I am. Hold on. Would you girls like me to demonstrate my technique? There we go. Watch that.
Nice.
Drew, you narrate. I'm just
right.
going to put the mic down.
Mike's down. Adam is taking a few deep breaths.
All right.
And
And action.
there it is. Okay.
Was that
he's
it?
leaning- that was it.
That was it. Hey.
That's what she says.
That was very nice.
It's good, right?
That was quick.
That was
I
great.
barely moved.
Yeah.
I didn't make a fist and start smacking my groin area, and I just held still, leaned back
And
a little.
received.
Enjoy.
Yeah. Spread the news.
We will.
No trouble for me when it comes to receiving oral. Mike?
To flesh this story out, we had a prostitute call in a couple nights ago. Remember this last night?
Oh, yeah, she was a great.
And
She gave.
said that was her specialty. And Adam said,
Receiving
it's
My specialty was receiving. I mean, our kids would be amazing. Hey, Mike?
Yes.
Why are you trying to steal my crown? Or do you claim you're the best at receiving oral?
How can I be the best at receiving oral? You see, if I get oral, I want to do the other thing.
Oh.
You want
wants to move on.
Yeah.
Yeah.
Because you're a passionate man. That's
Because you care.
that's what Drew. You care. You're 43 and you care.
That's great. See, his window is a lot bigger. See, that's
See how she likes
good.
Adam, see how that works?
No.
She responds.
No.
Yes, good thing, Adam. It's
No,
nice
you know what's
thing.
going on? He has what Drew has, which is the guys who don't really like oral sex, don't like receiving oral sex. It's not that they don't like it, but they're impatient. Like they get that for a minute,
And they
and they're
wanna
like,
move on.
I gotta move on.
You
Yeah.
gotta relax and enjoy it. And then
Yeah,
let
but
the
they
girl enjoy it
can't-
a little more.
They can't with that vagina floating around out there that they
Right.
can't get to. And also, Drew, wouldn't you say,
Yeah.
like, these guys are excitable guys too?
Yes,
Or, I mean,
sympathetic tone is up.
they have difficulty just sort of.
Yeah.
They don't get a lot of massages and foot rubs. They're not
think
guys
you're
that
right.
like to be handled and pampered.
I think you're right. I think I don't want to get into too much here, but
Yes, Drew.
No. When you're developing, your tone gets set depending on what happens to you in the first couple years of life. You either become parasympathetic or sympathetically predominant. You're
Right.
parasympathetic. Your engine barely runs.
Thank you.
No, really.
His
it takes
little
a lot.
jump start.
And I'm like over. I'm sympathetically predominant. I'm over.
For you to hold still for, let's just say,
Anything.
15 minutes and receive a BJ would be
For anything.
uncomfortable. Uncomfortable.
Yeah.
Okay, Mike.
Yes.
So maybe you're like Drew. Maybe just you have a fast motor.
I don't know. It's a shame I only have one.
One penis or one motor? One penis.
Yes.
All right. Are you married?
No, I'm painfully single.
Does he have a-
Painfully single.
Does he have like a steady girlfriend?
No, I'm guessing
Maybe
no.
they can like move up slowly, like one day do for like a minute and then have sex, and 2
Small
minutes and have
gradients.
sex. Exactly.
Right.
Good call, Mila.
Behavioral
Good call.
techniques.
See,
There we go.
I'm thinking, you know.
Right.
Well, there's a problem.
That's my plan,
wait,
except
here we go.
we started 20 minutes
There's a
ago.
Okay, wait,
problem.
what's the problem?
Here's the punchline.
Guy,
I'm a cab driver in New York.
All right.
That's the
I
problem.
meet a lot of people,
Yeah.
but their taxi and limousine commission rules that prohibit me from, doing it with the people I meet while I'm working.
right. Because Lord knows if those rules weren't in place, you'd bang every model that jumped in the back of your hack, right? I know how it is. They're hot. I mean, they see the back of that guy's nappy head with the crappy sweatshirt and the dandruff and the name they can't pronounce on the hack license up there. They get hot.
Big
Super
turn.
hot. I mean, you guys love a guy who drives a
Every
cab,
time I'm in
right?
New York,
Then
I'm like, woo.
And Eartha Kitt chimes in.
That's
Yeah.
why I have
Tighten
that
the seatbelt.
plexiglass there.
Right.
The plexiglass is to protect you from jumping
Yeah.
off the guy.
And
Yeah,
jumping
you'd
the
be
cab driver.
raped. You'd be raped from behind. Yeah, okay, Mike. These guys who are single are always sort of perplexed as to why they're single,
Yeah.
and then you
Right.
speak to them for
And it kind of makes a little more
2.5 minutes, and you're like, no, I'm so surprised no one's killed you yet. Forget about single. You're ahead of the game. Robert,
All right.
Yeah,
you're 14?
yeah.
What's up?
I was just wondering if ecstasy will do anything to your penis size or anything.
No, but it will make it not work very well. You're 14. How many times have you done ecstasy?
About maybe once a week.
Yeah.
Oh,
Wow.
It can really damage your
14.
brain, even at any age.
it'll
but
damage more than your brain, I would think.
Well, it really.
Does it make you like I mean, can you still get it up if you do it for many years, or?
Yeah, I can get it up easily.
No, but listen, the limbic area of the brain actually becomes destroyed by ecstasy. And when someone's brain is developing at 14, 15, 16, before you really finish that developmental phase, the potential of real serious harm is rather profound.
Doesn't even go through puberty? Isn't it like the most important to be like pure?
Well,
And
it really, the brain is very plastic up until about 16. I see the most serious problems later on in adulthood with people that start using drugs at 14 or 15 or below. Then it's because the frontal lobe development, the kinds of integrative function that needs to develop, just can't happen under the influence of some of these drugs. Pot does that, and ecstasy certainly does that.
so I mean, the older he gets, will he be able to not function as well?
He's going to have depressions. He's going to have difficulty with arousal. It's just going to be a mess.
I already have depression. I take like Effexor or something.
Well, it's going to get a lot worse, I'm afraid, Robert. Please stop doing the ecstasy, all right?
Okay, and another thing is my friend suffers from migraines, and do you know what that's called? And
What a migraine is called?
well,
Hold on, you want to look that up? Let's just start with that.
Migraine.
Starts with an M, right?
no, well, she's been suffering them for like a year or so.
I've had migraines for a really long time, and you know what my problem was an eye. So if your friend really has incredible migraines in the back of her head, she should get her eyes checked.
Oh, really?
Yeah.
Dude, what'd you need? What'd they do to you?
I have a huge problem with my eye, but with my right eye. I have cataracts, glaucoma, and iritis in my right eye, which, whatever, it's fine. But
She has 2 different color eyes. She's like
yeah,
a husky.
I'm bizarre, but
It's very cool.
thanks, Pre.
No problem.
But the way I found was a problem was because the back of my head, I'd have constant migraines for like days, and you can't get rid of them with medicine, nothing.
But those aren't migraines.
But essentially, it's what they feel like. They feel like
Yeah,
a migraine.
his 14-year-old friend doesn't know if it's a migraine
Right, she
or
has a
not.
headache. She
Bad
should get her
headache.
eyes checked.
I think
pressure in the eye.
that's the point, is that there are hundreds of causes of bad headaches. Migraine is one.
Right. I mean,
of the many
if you're
hundreds.
diagnosed with migraines, then it's
Yeah,
different.
then he needs a diagnosis, the friend.
Yeah, we'll go to the doctor.
Yeah.
Don't crap on Mila's point, though.
No, I'm not.
No, I'm just saying that if she has headaches, she should just.
I dig
Maybe
it. I
you
know
should
what you're
just do
saying.
some
Heroin.
ecstasy and everything will be
There you go. Laura's kind of a fan of the ecstasy. So.
Is there anything worse than a depressed male teenager?
I know.
It's always that.
At 14.
At 14, I'm picturing the bad skin with the bad mustache coming in, and he's not sure what to do with his hair, and he's all talks real slow.
Can't imagine ecstasy making it feel any better.
It does when they're using it. That's why they use it. But it leaves. I mean, you've seen the PET scans where you leave the big holes in the brain.
That's what ecstasy
yeah.
does?
Oh yeah, it's a mess.
Well, it's
I get to see these guys 10 years later. I'll see them at the hospital.
Yeah. I get to talk to him, though. That's right.
Well, then they're not 14-year-old screwballs.
Yeah, we talk to these people.
24-year-old screwballs.
But at least
so.
they're young enough to stop if they want. Now, 10 years from that point, they might not.
Yeah, it'd be nice. Tom,
Yes, sir.
you're 25?
Yes, sir.
What's up?
My mother is an alcoholic,
my wife's father is an alcoholic. Between the two of us, my wife and I, we don't split a six-pack in a month.
Mm-hmm.
What's the probability of our children being alcoholics?
If you really don't have the gene, which it's hard to say just because you don't drink, it's 0. Or
Okay.
it got to approach 0 anyway.
But are you trying not to drink, or is it just something you're not interested in?
That's the question.
It's just something I've never really done. I mean, I saw how it affected my mother.
I understand.
growing up.
People see that, so they avoid alcohol, but then they smoke pot, or they take Vicodin, or they do something else.
No, I've never touched a drug in my life.
And how about your wife?
She used to do a little pot when she was younger, but she hasn't touched it for the past 3 or 4 years.
And nothing currently? Not taking any substances? No Xanax?
No, nothing at all.
Okay.
How about a little, like gambling or porn addiction or something good like that?
Well, everybody likes a little porn now and then.
Yeah.
Yeah.
Number 1 receiver for oral sex. 3 years running now, by the way.
Well, I wouldn't consider 10 times a day addiction in porn, so.
What did you say?
What was that? You watch porn 10 times a day?
I think he's making a joke. All right, Tom, your kids are going to be fine.
Great, I appreciate the help.
All right, hey, good times. Do you have any kids yet?
Not yet, but we're trying. My wife was actually just diagnosed with polycystic ovarian syndrome.
Good times?
Yeah.
So it's been a little hard.
Keep her weight down. Make sure she exercises. You got to watch out for diabetes later with that.
Yeah, she's on, I believe...
Glucophage?
Glucophage?
No, it starts with an A, I believe.
On what?
Oh, wait a second. I'll put him on hold. I can't...
She's on what? Tom? She's on what?
Yeah, it starts with an A, I believe.
Avandia?
No, it's something...
All right.
Whatever.
Jesus Christ.
I think I need the dictionary now.
Here's what she's on. She's on something. That's the important thing. Oh, I'm going to raise my kids in a giant habit trail. Like, you know what I'm going to do? If I have kids, I'm going to convince them that they have one of those diseases where they can't be in contact with the outside world.
Bubble. Yeah.
The boy in the bubble.
Bubble boy.
Like John Travolta.
Yeah.
And I'm going to raise them in a giant habit trail, and they'll have one of those bowls they can
roll around like a hamster,
in.
but they can breathe through it. And of course.
Filter the air.
It'll make them so much better in life.
They'll be great.
No STDs.
No, they'll be so safe
No
and pure.
fights.
No.
And I'd say they commit suicide by 14. But
No, they can't. I won't.
they'll find a way. They'll plug a little hole in the
no
bowl.
shoelaces.
into the
no
bubble
nothing.
And they like
Suicide.
pop the bubble and then use the bubble as like a little
They'll
wrap
roll
around
the
their head.
bubble out of the freeway or over a cliff or something. What are you talking
I
about?
put a tether on it and a stake in the lawn, like corkscrew stake in the lawn. You know, it only has about 30 feet of rope on it,
Let
so
me
they
get
can't get too
electrocuted?
far. You mean like if lightning hits the corkscrew? I'm going to make it out of a alloy that doesn't
No,
transmit
they have an electric
electricity.
fence and a collar, and every time they go out to get
It's
electrocuted,
like a
they get a
little deer
shock.
fence.
Whatever it is, the kid will be fine.
It can work.
He'll be fine.
Kid will
All
be
right.
fine.
Yeah.
Take care of that kid. All right. Should we have 6? Speak to Jay, who's 17. Jay?
Hi, how's it going?
Good.
All right, by the way, first thing I want to say, Lauren, you play Donna, right?
Yep.
I think you're hot, just so you know.
Thank you.
Just so you're clear.
Yeah.
Thanks.
Well, wait a
I
minute.
appreciate that.
Do you go by Laura or Lauren? Or
I get both, but I'm not really, whatever. It's fine.
Oh,
But it's Laura.
I'm so in love with you, by the way. I love people who don't care. They're so passionate
Did you
about
call her
not
Pre?
caring. Yeah, well,
They called her Pre?
nickname.
I don't know.
Yeah, that's my nickname.
Prepon, because it's Laura
Pre. You call her-
Prepon, so it's
They called her
Pre.
Pre when she walked in.
They all call me Pre.
It's shorter. It's easier.
Yeah.
You get lazy in
And
5
she's little
years.
brownie.
So,
Brownie.
Little brownie.
Little brownie.
and she's big red.
Yeah.
Big red.
Yeah.
Just to get into her nicknames. But anyway, I'm sorry.
Keep
Go
going.
ahead.
All right, anyhow, sorry. You said earlier, I remember you guys were talking about how your guys are not experienced. Obviously, couldn't get that one girl that was couldn't orgasm. I remember you telling me that, right?
Mm-hmm.
What they said was that 17-year-old Adam, I believe, said 17-year-old males. Come on, how inspired?
Oh, are you offended that we said that 17-year-old guys don't know what they're doing?
He's like,
no,
I'm a pro.
I was just trying to prove the exception to the point for those of you guys out there that can, yeah, we can.
Well, yeah.
Okay.
Okay.
Yeah. Wow, you sound hot, Jay. What are you wearing? All right, listen. Are these the kind of calls we have to take? We say 17-year-old guys aren't great in the sack. Oh, we got a little rebuttal. We got a 17-year-old from Pasadena wants to say he's hot in the sack. Noted, Jay. Thank you. All right. Well, I guess I was all wrong about this topic. Drew, what about you? Have you turned it around?
Even no.
Still trying to figure out what to do with the calls. Maybe we should clear the deck here.
We should?
Except for this one.
Derek?
Yeah.
You're 16?
Yeah, I'm 16.
What's up?
I just want to say that you guys are both, I wish everybody in the world was as logical as you two, because then the world would be almost perfect. But anyway.
Almost, but not quite.
Logical, I think you said.
Yeah, it came out like law school.
Just about. I mean, there's still a few idiots out there. But anyway, my problem is right after I masturbate, like for an hour or two, like any thought of sexual, anything sexual with a girl just disgusts me, and it just grosses me out, and I don't know what the deal is.
Disgusting?
Yeah.
Maybe because you're tired afterwards and you don't want to have to deal with it. I don't know.
It's like eating. You
But he's 16 though.
But shouldn't you be turned? I mean, unless he's interested in the opposite sex.
Yeah, but if he's 16, shouldn't he, when he's done, be like turned on right again 5 minutes later?
It seems like it.
That's what I thought. Yeah.
Are you disgusted with everyone else or disgusted with yourself?
Disgusted, like, I can't think of anything sexual at all with a girl, like, myself. But
And then you sort of disgust yourself with the ideas of it.
Yeah, kind of.
You know what that like, you've mentioned that feeling before.
Now I disgust myself. Yeah.
It's sort of a guilt.
Not for an hour.
After he receives.
After he's
done.
so professionally
He's the number one receiver.
Yeah, you guys want to see my picture? Yeah, there it is. Nice, huh?
Yeah, very.
No trouble for me. Not at all. That's right, like a corpse. Steady as a rock. You cut a diamond on my forehead. I wouldn't move. Hey, Derek?
What about the other working part?
All right. No. Couldn't poke a hole in a loaf of bread. Hey, Derek.
Yeah.
Yeah, who cares? You're fine. You don't care. You don't like chicks for an hour? Good. You just beat off again. Then that hour comes up and you're ready to beat off again, right?
There you go.
Well, kind of. There's nothing psychological about
No, you're fine.
Well, I mean, listen, if you're vomiting and beating yourself with a slipper or something, that's one thing. Or if you have ambivalent feelings toward women sexually, maybe you're thinking about guys or something. That's all. If you're molested or something, is there anything we need to know about?
No, there's, like, I was molested when I was younger, but that's it.
Wait a minute.
Except for that.
I'm wondering.
Bogus?
Yeah.
No, seriously, it's not.
Who molested you?
My mom, when I was like, I remember when I was about 7 or 8, getting my first
perfectly normal, perfectly healthy.
Your mom did what? What did she do?
I went in, after I had my first erection, I went in, I didn't know what was going on, because I was scared, because I didn't know, I thought something was wrong with me, like most little kids do. And I went in there and I asked her what was wrong, and she freaking felt it, and I was like, I didn't know any better, I was little.
What did she do?
I don't know.
She just felt it, and I didn't know any better.
Well, touching, I mean, that's sort of, I agree, a boundary violation, but she just touched it and went out.
Well, listen, my buddy Chris took a towel and he wound it like a rat's tail and he snapped his brother Ricky in the nuts with it, and his mom had to rub cream on it. And I mean, he whacked it. I mean, snapped it right on the sack. The kid was 6. He was screaming, running around the house. It was great. It was great. We were like 13. But the point is his mom touched, him. It wasn't.
But she touched him or
sex.
Yeah, I mean, she had to have known what was going on, but I wasn't like.
Derek, I got a sense that there was already some disgust in you about sexual organs and girls and mom and stuff like that. I think those feelings were already kind of flying around.
There's no way I would have sex now.
Wait. No, hold on a second. Now, what's wrong with this, Derek? Quiet down, Drew.
With his dad?
Would you quiet down and let me speak for a second? Something's wrong with this kid's brain. I don't know if this is bogus. I don't know if he just misinterpreted this. I don't know if there's more that his mom did and he's not letting on. So let me question him for a second. Derek.
Yeah.
What did your mother do besides touch it? I
went in there. I had been in bed and I had popped an erection, and I went in there and I said, I was like, well, what's wrong with this? What is there something wrong with me? And she goes, let me see. And I pulled down my drawers and she felt it.
What else? That's it.
Just rubbed it or touched it? What did
Yeah, they rubbed it, and
he's bogus. This is bogus. First off, no 7-year-old gets a boner and goes to ask what's wrong with this.
Yeah.
It makes sense. It sounds like you would do it. Nobody's ever done it.
Would you remember?
You got 2 boys, Drew. They ever run in and ask you what's wrong with their dork?
Are you high?
Drew snapped the towel at it, right? No, they don't do that. And then he won't come clean with it. She touched it. She touched it. She touched it. You better come up with something. You're scared. You didn't know what was going on. Really? I don't believe you. And would you please tell me what your mom did other than touch it? What does that mean? Did she yank on it? She put it in her mouth? What'd she do?
No, she just felt it. I mean, it's bad
Sexually, in a sexual way? Did she caress it?
Like she was examining it to see if something was wrong. You came in complaining about something wrong with your penis. She feel it, look what's going on.
Then what?
Yeah, what Dr. Drew said, that could be, I guess that's what she was doing. I hope that's what she was doing. I hope she wouldn't do anything.
Did it ever happen again, or was it like one time?
No, it was just that one time as far as
All right, that's not molested by your mother. You walking your little 7-year-old boner into the kitchen and asking her to look at it.
No, I see.
Something's wrong with there.
I know. Disgust is an interesting emotion, okay? Disgust is not something. It's a very,
not
very
disgust.
Yeah, but just know that it's a very, very powerful emotion. It's not something that usually people experience after just masturbating.
Okay.
I mean, disgust was flying around for him already. Something happened early on.
Let me ask this: is he angry? Is there something up with him?
Yeah.
Thumbs up. Like,
yeah.
does his dad beat on him or something? Derek.
Yeah.
Are you an angry guy?
No, the one thing that makes me angry is pregnant chicks at my school. We used to not have any, and then this year we had 13, and that really pissed me off. I don't know why.
Now, where's your dad? Where's your dad,
Okay,
Derek?
that's exactly what I was.
Where's your dad, Derek?
What's that?
Where's your dad?
My dad lives with me, and we have a good family life.
He does. And
you weren't adopted or anything yourself?
No.
Dad never beat on you or anything?
No.
No, this is a subtler thing. This is between him and Mom early.
There's something weird. Something weird. You have strange feelings toward women, Derek.
Yes, that's
you're gonna be one of these weirdo guys if you don't be too careful. So just relax, would you? Stop with the impulse, and beat off. Give yourself 2 hours before you're done being disgusted next time. Would you?
You ought to be ashamed of yourself.
Mila and Laura both here from That 70s Show Tuesday nights. Fox. Hey, Fox. We'll take a quick break. We'll be right back. Hey, everybody, it's the Loveline. I'm Adam Carolla. That is Dr. Drew. Phone number 1-800-LOVE-191. Mila Kunis and Laura Prepon are both here tonight. That 70s Show, Tuesday nights, 8 o'clock on Fox and in syndication as well. Wait a minute. Mila, you do Meg on Family Guy?
Which is currently canceled.
Oh,
yeah. But
It is you. That is you.
Yeah.
That's right.
But they're coming out with
show.
It's a great, and it's an extremely smart show. They're coming out with a DVD package with like all the shows. Yeah, it'll be awesome. With a commentary of like Seth and I and Alex and Seth MacFarlane doing all this stuff. It'll be great. Yeah.
Oh, that's great.
Yeah, it's a really fun show. I don't know why they canceled it, but it was really fun.
Yeah, it was a little too good for people.
It should have been like a Comedy Central show. It should not have been a network show.
Yeah. It's really funny, really good.
But it also went up against like Friends or something like an NBC where it just didn't.
They kept moving it around,
Yeah.
and people are.
Well, it premiered after Super Bowl or something. They just went downhill from then.
Yeah, they kept moving it around. I love that show.
Cool, thank you.
Yeah, big fan. Sean?
Hello?
26, what's up?
Well, me and my wife, about a year ago next month, had a baby. And, well, ever since she had the baby, she has, like, no sex drive. And I was just kind of wondering, is that normal, or when will it be back?
How long ago was the baby?
I like the sound
This is
effects.
the greatest sound effects I've ever heard.
She had it, it'll be a year ago next month.
The year ago, so it's been over a year. Has she been depressed, too?
Well, a little bit. She says she has been. She says she just doesn't feel like herself.
Well,
Isn't there something attached to having a baby afterwards? Where
I know.
like,
Didn't Marie Osmond have the thing where she went like?
Well, there's postpartum depression.
Yeah, there's that.
Which is what one of the things that caused that woman to go kill her 5 children. I mean, it can be very, very severe.
Right.
Or it's also common for the massive hormonal shifts of pregnancy just to leave women in sort of an altered state biologically. Is she still breastfeeding?
No.
All right. And just that, it's very common for women to have no libido, not to mention you're adding in the child care demands and the change in your family systems and how you perceive each other as parents now. But oftentimes, something as simple as just getting on a birth control pill and stabilizing the hormonal environment will get her sex drive back.
Well, she's on ortho tricycline, I believe. Is what
All
she
right.
takes.
Well, that's the one that usually works, but for some people it doesn't, and she may try switching around a little bit. And then if not, she needs to be evaluated to see if indeed there is a depression, because that can be really serious.
Sean?
Okay.
Calling from New Jersey?
Right.
Yep. Real Jersey boy.
Nice.
Born and raised, right?
Laura's hometown.
I'm from Jersey. Why? What? There's no cows in Jersey.
No, where's Sean from?
Newark.
Newark.
By the airport.
Born out there?
What?
Doesn't sound like...
Born where? Trenton.
Trenton.
Born Trenton, Adam. Come on.
Wow.
Can't you hear the Trenton accent?
Sure. What, where's your dad from?
North Carolina.
There we
Uh-huh.
go. That's it.
I
Yeah,
don't
you're...
sound like that.
Yeah. Now you sound like your dad, right?
Yeah, I guess.
All right. It just didn't sound like New Jersey to me, that's all. I was surprised to see that he was born there.
Yeah.
So now here's a guy who probably spent a little more time at home, maybe doing a little hunting and fishing with Dad than with the guys.
Want to ask him?
You know what I'm saying?
Yeah, I agree with you.
Yeah. Not a judgment.
Yeah.
Sean?
Yeah.
Were you close with your dad? Are you close with him?
No, he's dead.
No,
Uh-huh.
I mean, growing
You
up.
killed him in a hunting accident? Oh, that is not funny.
No,
growing
I
up.
wasn't laughing
It's
at
tragic.
the death of his father. I was laughing
That's
at
what I
your
heard.
reaction.
That's what I heard. When did he die?
85.
Oh.
That was a long
Geez,
time.
you
When you were like 8?
He's trying to keep his spirit alive with the accent.
you were like 9 years old when he
Nice
died?
Eight.
8 years old. And were you guys very close before that?
Not really.
Oh, Adam, so much for that theory.
There he goes.
Why do you sound like Enos
Let me float
from
something.
the Dukes of Hazzard?
Let me float something. When your dad died, they didn't send you back down to your grandparents in North Carolina to be raised for a while, did they?
Yeah, we moved to Jordan.
Oh, right.
Oh,
Come on.
Look at the world's dumbest callers. World's dumbest. World's dumbest.
Well, I was just letting you go. I mean, you were, going around trying to figure it out. I was just letting you figure
Okay,
it out.
but listen to me.
It's so passive aggressive.
Listen, Sean, you sound like you popped out of the. You sound like what are you guys doing over there? You
We're
doing
trying to
your
figure out what his problem is.
Wait, is this the one with the wife?
Yeah.
Okay,
All right.
see, I didn't get. Okay.
You sound like you popped out of the goddamn cornfield and hee-haw to tell a joke. Then it says up on the screen you're from New Jersey, so I say I'm confused. I asked if you were born there. Hey, you just keep going. Yep, hey, you beat me on a technicality, you genius. I hope you never get laid. Never. Idiots.
He has a wife.
There's no idea what.
Yeah, but she doesn't
are
want to
people
have
like
sex.
passive-aggressive? Do they not know what we're asking? She said, Drew, at least you got to the bottom with that, sending him back to North Carolina.
Yeah.
What's up with you two? It says he's from
What?
New Jersey, and you guys are like, that's
What?
right.
I'm from Jersey.
I'm
She's
Jersey.
from Jersey.
Yeah, did you know a lot of guys like Sean in Jersey? Yeah,
Accents.
All right, why didn't you say something?
I don't know, dude. I don't know.
Why do
You know
I
what
got
it
to
is?
play the
When
heavy?
I have kids, I want them to speak the British accent, so I was actually... But then I want them to drop it when they're around 14. So I'm listening like, why would he have the accent when he's from Jersey? I was interested.
You know what it is? People just go with
Did I
whatever.
just freak you out? You're looking at me like I'm crazy.
No.
Oh, you just said like, hey,
Conference.
Jersey boy.
Hey, Hannah.
Hey, Jersey boy.
Just smoke on something first.
You guys high?
Yeah,
You guys are high.
They are.
No.
Yeah, we're pretty high right now.
Yeah. No.
All right. Yeah.
Look, we're trying to pay attention, but the whole accent thing threw us off. We were listening
Yeah, I
about the
didn't- you know
pregnant
what?
wife
He
and all
didn't have an
that.
accent when he was originally talking about his wife, did he? Or am I
Yes.
completely
Yes, he
crazy?
did.
He
Yes.
did?
Yeah.
I didn't even
I
know.
think he was
What's-
just messing with you guys.
What's interesting, now they're on the ball. Now they're with us.
No, he wasn't. He did what he said he did. He went back to South Carolina or Georgia.
But
All right,
lost
Drew.
my train of thought.
Good. Good. Let's hope
Oh,
it
you know what?
stays
No, what I was
that
going
way.
to say is that people kind of go with whatever you tell them. You know what I mean? People don't stop naturally. They don't stop and go, whoa, wait, what are you talking about? Who are you
He's
talking
afraid
to?
you guys are going to make fun of him. You
Well,
guys
no. I mean, we all do this. We just kind of go. Somebody goes, oh, I'm from Jersey, and you go, oh, okay. Sounds like he's from North Carolina, but says he's from Jersey. So.
Yeah, but I think he was intentionally having a little fun with us.
Ah.
He said he was.
He
He,
mi- I-
said he was
maybe.
tugging,
Maybe he was
tugging
a
our
little
chain
high.
a little bit.
Yeah.
answering
Maybe he
the
was high.
questions.
There you
Exactly.
Yeah,
That's what
see
I'm
that?
thinking.
That's
Yeah.
for me. Like,
Nice.
There you go.
Yep.
Good call, Meals.
Thanks, Bree. I'm thinking.
Clayton.
Clayton, you're 21.
Hey, how you doing, Adam? How you doing, Drew?
Hey.
Good.
Hey, I wanted to ask the girls a question. What were your experiences with getting into acting, and what would you recommend for me?
Forgot. You've been keeping track of his career, of
I
course.
thought we were going to help kids with sexual problems. What?
Maybe he can have sex with a casting director.
Yeah, that can work. Go have sex with like a big producer. No, I'm kidding.
Ferdinand, get the hell out of Bakersfield, Clayton, right?
Yeah, where are you from?
Bakersfield, California. Moved to Los Angeles.
No. Do we need Clayton running around here? Really? Is that what we need? Him bringing us our iced tea? No.
Here's
Stay
my
in
advice.
Bakersfield.
No, wait, here. Seriously, though, keep studying acting. That's my advice.
Wow.
Study it, and then sooner or later it'll happen.
Are you studying acting, Clayton?
To an extent, it's just, right now I'm stuck in a body shop job. I just can't get out of that crap.
Mm-hmm.
I don't know, I'm trying to make a future for myself, but there's just no openings up, you know?
What do you mean make a future?
I don't know, man. I've been, like, poor my whole life, and it's kind of like, I just want to get out of this crap, dude.
Maybe you can play Adam in the Adam Carolla story.
Yeah.
So are you acting because you love acting, or are you acting because you think you'll make a lot of money and that's the only reason why you do it?
No, it's...
Because it's a lot harder than just
Yeah, you can't, because you won't probably end up making money when you start. You probably end up being in debt when you start.
Well, I understand that completely. I've actually helped on 2 sets that were actually out here in Bakersfield, which is kind of funny, you know, and then I've seen the hard work that goes into it.
Mm-hmm.
And
what are you doing at the body shop?
Right now I'm doing prep sanding and masking, and then clean up after they come out of the paint booth.
Mm-hmm. Nice. Yeah. You'll do a little wet sand action on
Actually, that's the buffer's job.
And I put the catalyst from the Bondo on my face once.
The hardener?
Yeah, the hardener. 90% benzoyl peroxide.
Dude, that stuff is hot, man.
Yeah, it's good. Works on zits.
Oh, yeah.
It burns a hole in your face.
Well, gets rid of the zit.
There you go.
Hey, Clayton, listen. Start doing whatever you can do. You know, go down to see about the theater, you know, the local theater, the classes,
But do it
all that
because you
stuff.
want to. Because
it's fun.
Yeah, don't do it to make money.
I mean, there's a lot of competition. You just have to love doing it because it can, you know.
And stick with it. I mean, it'll be hard. I mean,
Yeah.
Just take some
about
classes.
Right. Don't move to L.A., though.
Oh, understandable.
All right, buddy.
I don't just want anyone else.
Good times. Good
You
times.
too, brother.
All right. Yeah, you do it because you love it. That's right.
That's why you do what you do, Adam.
No, listen. I really made a conscious decision. Carpentry sucked, and I didn't make any money. And I used to listen to morning radio when I was swinging a hammer. I'd be listening to like Mark and Brian or Rick Dees or something. I'd be like, how much are these homeless getting paid? Are you kidding me? Are you kidding me? These retards are getting $2 million a year, and I'm getting $25,000 a year. Oh, I got to do this. These guys are horrible. Yeah. Now look at me. Not making that much money. Yeah. Yeah. But if you combine my 8 jobs, I'm still getting paid almost as much as Mark or Brian. Oh. Can you believe that? What is going wrong with this industry?
Yeah.
Jesus Christ.
Last night the pie's been divided up so much.
Oh, my God. I got to go kill myself. All right. Well, Laura and Mila are both here from That 70s Show. We'll be right back.
Hi, this is Chris Griffin, and you're listening to Loveline, which I'm not allowed to listen to because they say works like grass.
That's great.
Yeah, me and Laura both here from That 70s Show. Tuesday nights, 8 o'clock on Fox and in wide syndication. And Seth Green is Chris from That 70s. You guys having?
No, I was asking her if we're coming.
When we were on, because we don't know what our schedule is.
Well, we were preempted by baseball, so I was asking Mila if she knows if we're coming on tomorrow or not. We're not telling secrets over here.
Conferences.
We'll definitely let you guys in.
Tell you that baseball. I was at Game 6. Crazy.
Was it fun? I went to Game 1 and 2. Laura and I went.
Yeah, I only went to Game 1, but it was a great time.
Down 5 runs in the 7th inning.
It was great.
It was fun.
You know, I like the second game so much better because in the first inning they got like 5 runs. Second inning was 4. I mean, it was so much more.
Oh, that was it.
high-paced.
Yeah.
The first game was kind of like dragged on, but the rally monkey came on way too many times.
What is up with the rally monkey?
Like, it's cool because it's nice and gets the audience all pumped up after the 7th.
It's just a monkey jumping on a chair.
Right, but it's like an Angels thing, and it's only supposed to come out after the 7th inning if the Angels are down.
Where is it? Where is he?
He's jumping on a chair.
He's on a screen. He's not actually at the game, which is what...
He's just on the billboard.
Yeah, he just pops up and he goes, rally time.
It's really weird. I didn't get it. I was like, what's up with the monkey?
The first game, it was on like every other inning. The rally monkey popped up. And
now they bring him out a little bit later.
It's 7th inning if the Angels are losing.
Right. So they brought him out in the 6th of Game 6, as I recall. All right, you ready to go here?
Nope.
You want to know any more about Game 1 there, Drew?
No, I'm
because Game 6, Game 6.
I don't know. Game 1 was pretty good.
Never in the history has a team been down by
5.
Yeah,
Really?
I was at that game. But all right, ask more about Game 1, or do you want to go back to the calls there? Yeah?
Let's go back.
Okay, fantastic.
Let's talk about the parking problems.
Hey, how's it going, guys?
Talk about parking.
Dude,
Never
we can talk about parking.
Never before.
We are having problems with that,
8 inches to the left.
We used to get Adam on one of his rants.
Yes.
This close with Drew. Drew, what's up with you? Lean back in your chair. Relax. Drew's, can't finish a thought tonight with this Drew over here. Mike?
Hey.
You're 16?
Yeah.
What's up?
Just asking a quick question. Just wondering which condoms were more effective, if the male or the female were?
I don't know if there's a difference in effectiveness.
Oh, really? Like
if they're used properly.
So both can pretty much work as
what? Female condoms? What?
You've seen those.
Oh,
I never understood those.
Neither did I.
Don't even go there. It's too confusing.
They're like big sacks with a...
But you put it up the...
There's a ring on the end. You sort of compress and it...
Yeah, that...
How do you take it out? What do you just stick...
The whole lot of it's outside already. You just kind of pull it
that
out.
just sounds like too much work.
Yeah.
Out of curiosity, how effective are condoms?
About 80 plus 88%. Used properly, they're pretty good.
Well, if they don't break or you put them on right. Mike?
Yeah.
Yeah. You're thinking about using the female condom?
I don't know.
That laugh was, there's no opportunity to use any condom.
Yeah.
You're just writing a paper, right? You're not going to get laid for another 5 years?
Yeah, okay.
Yeah.
There we go.
All right, buddy.
All right, none. Thanks a lot.
Good time.
Hey, do you have a car?
Do I have a car?
Yeah.
Yeah.
You do?
64 Camaro.
Ooh. Oh, really?
Nice.
Yeah.
That's a hot car. You should be getting laid.
Yeah.
He's like, yep.
But, yeah, you guys are gorgeous. I love your show.
Thank you.
Yeah, of course. You know, Adam, you're
right.
Thank you.
Hey, I was just wondering, did you ever do stand-up, before you got onto radio and all that stuff? Or like?
Oh, man, me a little bit. Not much. Didn't like it.
Why? What was wrong with that?
A little bit, like twice.
No, probably 40 times or something. I didn't like the repetition part.
Translation, he wasn't good.
And, Drew, you know what you'd be making if I wasn't here?
I'm not saying you're not good now. You weren't good at stand-up.
Seriously, you ever stop and think what your paycheck would be?
Probably still zero.
Drew, you're getting zero no, you're getting, I don't know, 80 grand a year or something when I showed up. You ever think about that? Think about if your old partners were sitting in this chair. How much you think you'd be making? Think about that. Okay. Let's go, sorry, I had to take a little serious turn there for a second. But Drew's motto is I'll make him the money and make the phone calls. We'll get it all worked out. Carl?
Yeah.
You're 31?
Yeah.
What's up?
Well, I kind of had a question for the girls.
Go right ahead.
Okay.
Well, I have this friend, and we've been friends for a while, and over the time I fell in love with her. And she's just recently coming out of a abusive marriage.
How old is she?
She's 27.
27?
And he's 30.
How did you become her friend? Was it work or something?
Actually, we go to karaoke together.
Mm-hmm.
Does she know that you are in love with her?
Well, that's where the problem came in.
Hang on a second. Carl.
Yeah.
Forget it. You were into her from the moment you saw her.
Yeah, and she was in an abusive relationship, which means she's got issues.
But you right away sort of went for this, but knew to hold back.
You're picking up the pieces, and you're up there singing Tears of a Clown, and it's very ironic.
He's going to be the rebound.
Wait, but he didn't know about the abusive relationship.
But the guys do this. Guys if they're going to be in a friendship, is because they can't get it going further. And they kind of contain themselves and wait. And now as the relationship falls apart, he lets his feelings kind of develop, and here we are. Now you're in.
But do you really want to be involved with someone who's getting out of an abusive relationship?
Well, I didn't meet her until after she was out of the relationship.
Okay. Now, what does she say now? Does she want to be involved?
What happened was, my best friend told her that I was in love with her, and she really freaked.
Yeah. Why did she freak?
Because she has feelings for me, but she's afraid.
Oh, please, Carl, please. Please, sorry, Carl.
God, I don't get entertained too much on this show because all I got is myself, and I don't like myself that much. But except for when Drew punches his mic, but I really do love those kind of things. She was scared of her feelings. Yeah.
But maybe she just doesn't want to. But it makes sense.
No, look, just think about it this way, Carl. If she were really excited and into it and wanting to have a relationship with you, and she found out that you were into her, how do you think she'd react?
Well, that's the thing. She told me that's why she was upset, is because she is scared because I treat her so nice.
Yeah, and she's got issues. She's abusive relationship, Drew.
Oh, yeah.
Carl, listen to me. You understand I'm a genius, right? You know that Drew would be making 50 cents if I wasn't here, right? That's weekly. That's not per show.
You're the cash register.
I am the cash register. Listen to me, Carl. Do not pursue this. She's got issues. I know you're going to keep doing it. You're needy. You're one good date with a nice chick away from getting out of this. You're going to waste years of your life with this.
This is not going to go anywhere, even if he does reel her in.
Find somebody and date them. Stop this.
Yeah.
Okay. We'll take a break. We'll be right back. Everybody, it's Loveline. I'm Adam. That's Dr. Drew. Phone number 1-800-LOVE-191. Mila Kunis is here tonight, along with Laura Prepon, both from That 70s Show. Tuesday nights, Fox, 8 o'clock, and syndicated. What's it on? Let's see, Fox, 6:30? No, wait.
Syndicated 6:30 and UPN.
Oh,
On
UPN.
13, yeah.
Well, yeah, that's right. You got another channel.
Yeah.
They wouldn't.
But every like I guess city or network, however that works, has a different syndication.
Is it on Fox stations anywhere? Other
It probably
places?
is. I mean,
it's UPN Los Angeles.
It's UPN Los Angeles, but in every city,
it's different.
It's different, yeah.
Right, because The Simpsons is Fox, but it's syndicated on Fox here, and same with King of the Hill, and I'm sure there's other examples of that.
Like Married with Children and stuff is syndicated on its own network. Married with Children is syndicated on Fox and was produced by Fox, but we weren't produced by Fox.
Right.
We were produced by Carsey Warner.
Yeah.
So it's a little different.
Good people over there.
Yeah.
All right, let's get back to the phones and speak to Sam, who's online too. Sam, 17?
Howdy, guys. What's up?
Hey.
What's going on?
I just want to tell you guys, first off, I have great respect for what you guys do. I think the whole show idea was awesome. I listen to you guys like every night.
Thanks. It's always a little anticipation when it's you guys, because we're not sure if it's that 70 show or the show. Usually lands on the guest, but we'll take this one. Thank you.
My question was, okay, like a week ago, I had unprotected sex with a girl, right?
Mm-hmm.
All right.
And I heard through a friend of hers after she moved from this town that apparently she caught some STD from me that was like the common cold. And my question was, how the hell did she catch that if I lost my virginity with her?
What is this common cold reference? I don't understand.
Apparently it's like a very easily passed on. You catch it.
Well, there are many of those, but I don't understand.
I don't know which one it was. That was all I heard.
Well, probably didn't get it from you if you lost your virginity.
Right. There's probably that.
I was wondering.
But then again, he should have had something.
Yeah, I should have been wearing a condom.
No, you should have contracted something if she had something that she was harboring that she now blamed.
Well, maybe she got it after him.
It happened. How long ago did you lose your virginity to her?
Like a week or two.
A week ago, and then she leaves town within that week. It's kind of.
You drove her out of town, Sam, with your penis?
I guess, man. I don't know.
Sam's from Alaska, too. Want to ask him about moose?
Go right ahead, man.
Do you have any sex? Ever have sex with a moose?
No, the thought never really crossed my mind.
Interesting. Do you ever see any moose or mooses or moose-eye out there?
Oh, yeah. Just about every day. I live in a real small town, right? I mean, there's like 128 people if you count the dogs.
Do you live by the Wabbit-Wibba?
That was the last night. Yeah. All right. So she's out of town. So you should get yourself checked out. Do they have some...
check.
Well, not what's...
Nice.
If if you not have any symptoms, it's really, I'm not sure it's going to be that fruitful to get checked out.
I'm not showing anything. I mean, I have
It would show in a week, though, this common cold
she probably just got a
STD?
vaginitis just from having him in her. It just upset the flora in there.
Maybe he had an immaculate infection.
Immaculate?
That's funny. See?
Thanks, man.
It's a wordplay on conception.
I got it.
All right, and I got one other question real quick. Before
See what it's like, Anderson? You see what this is? Yeah.
Suck my dick.
All right, go ahead.
But, all right, I started going out with this chick that I just met, right? And I went to a Halloween party with a friend of mine, and she was hitting on me big time, apparently. She really likes me. I've grown up with her. I know her. I'm, like, stuck in the middle. I have no freaking clue what I'm doing right now.
Well, she's into you. You're into her?
No, he's not into her.
Not into her.
Yeah, well, a little bit. I mean, I understand her.
It said it's weird. It's weird that it's like your sister or something. You've been growing up with her and this sort of thing, right?
Kinda. I mean, I grew up with her for like 6 years.
Yeah, so that's always weird.
It's always weird. But
I don't know. I'd just say, just tell her you're not interested. Just if you're friends with her, obviously, if you guys have any bit of relationship before just saying. I mean, if I was interested in someone and they weren't interested in me, I'd rather hear it.
Or is it?
You don't have to say anything though. Just
I mean, if you do have, if you're 6 years that you've known this one person, you should be able to have enough trust to be like, I don't like it.
Or is it? It's weird that now he's developing these sexual feelings, and it's someone he's always considered like a sister. Now,
How old is he? How old are you?
17.
Okay.
Well, don't a lot of people start out as friends and then,
build? But if obviously if he doesn't like her.
Does. Yeah.
So he doesn't like her.
Sam.
No, he doesn't like her. She likes him.
Sam, what is your question? Do you like her or not?
I like them both. They're both cute. They're both smart. I mean, one of them I see obviously a lot more than the other.
Well, the other is the one that moved out of town, right?
No, the other lives in Kenai, which is like 100 miles away from me.
All right, hold on a second.
I'd say forget about the girl that got the STD from you, supposedly. Forget, because she sounds like trouble. And if you had all have any bit of it, I just personally.
I don't know if that's I don't know if that's the other.
Yeah,
is that the other? I said the other moved out of town, and he said no. She lives.
I like her answer.
No, wait, I'm not done. Sam. Sam.
The one that.
Sam, listen to me. Is when you say the other girl, is that the one you originally spoke of, who you lost your virginity to? No, that is the third girl.
The one I'm going out with right now.
Right.
Is.
Okay.
And she lives in Kenai, and.
Right. Sure.
The one that.
Kenai.
Right, Kenai, I know where that is.
The Rabbit River.
Right.
Yeah.
The Rabbit River.
That's just about 80 miles as the moose flies from where you are.
Okay, look, I don't know who's from or whose girlfriend is who, but I'd say forget about the STD chick, and then if you like any of the other girls, just go for it. You're young, you have nothing to lose, and enjoy your life. That's my request.
All right, Sam.
Good call, Mel.
All right.
Thank you.
All right.
I just think that when you're 7, you just don't have to think about it that much.
What do they
do? It.
What do they do? They pump like they put Quaaludes in the drinking water over there in Alaska. What goes on over there?
Very, very cool thing. Everything slows down.
That's what it is.
Metabolism slows. Everything slows.
Yeah, like if you take molecules,
they slow. Yeah.
Yeah, and you take liquid nitrogen to them, they just almost stop, right?
They're not vibrating so much.
That's what's going on.
Yeah.
That's what's going on. Okay. All right, let's talk to Molly, who's 18.
Hey, I just started a methadone detox today off of heroin.
Yeah.
And they didn't give me enough of the methadone, and they say that tomorrow they can give me more if I want, to keep me well or whatever. But is that worth it, do you think, if I'm doing this to, like, get off of heroin?
Take a little Vicodin tonight, take some codeine, smoke a little heroin.
Drew, please.
Molly, it's better, if you really are serious about getting off heroin, go into a hospital and get off heroin and take care of this. The detox is not bad. It only takes about 3 to 5 days. Methadone's fine.
Well, see, because I've done it like that before, and I always end up going back,
All right, well, you got to stay somewhere for 6 months or so and get in the sober setting.
The methadone is at 18. Doesn't seem like a great angle.
It's okay to detox methadone, and one of the criticisms of methadone in the past is that we didn't use enough of it. So to use more is fine if you're going to use it. But if you're going to end up on methadone maintenance, that means you're going to be chronically ill the rest of your life.
I'm not doing the maintenance thing, and I'm going into like a residential place after I'm done with the detox.
All right, then take as much as you need. But as you taper down, it's going to be uncomfortable no matter what. There's no such thing as a perfect detox.
Well, just because, like, they gave me 30 units or whatever today, and they say that, like, tomorrow they can give me 40 and then 50 and then start going back down.
Yeah.
But, like, should I bother even doing that, or should I just stay, like, at 30 right now?
No, go on up. Go. I mean, if you're going to do this, follow the directions. Stop. Go ahead and surrender. Stop trying to do it on your own.
Okay.
Let some people do it. Take care of you. Follow directions.
Are you just trying to get through the night, Molly?
What do you mean?
Is tonight the problem, or is it?
Well, I mean, yeah, tonight sucks, but, like, I don't want to be on heroin anymore, you know?
Okay, well, you've got a good plan to go into a residential program. It's an excellent plan. Go ahead and do the taper. Get off. You know, try not to chip. Get in that program and get going, all right?
Okay.
It's a good plan. It's a good plan.
All right. Hey, Drew, what about a little booze? Huh?
No.
Not a good plan?
Not a good plan.
Make it through the night?
Not a good plan. Not pot, not booze. I know you. That's how you get through every night. I understand that.
Yeah, well, what about tonight, though? Like, specifically, anyway?
Well, go to bed.
I can't sleep, though.
Yeah.
Yeah. How about, you can't, like, you can't do, like, 1,000 jumping jacks till you fall over or something? That's my plan. Drill everyone to death.
Yeah.
Hey, what about tonight? How does she get through tonight? She doesn't want to do any heroin. You're telling her not to drink any wine.
Want to go to a meeting and get somebody to help you get through this night?
It's late. It's 11 o'clock.
No, in the numbers you can call if you're like trying to relapse on something. You can just always call a number and they'll come help you.
Yeah, you pull into any Denny's, there's got to be a bunch of rehab people
Can't you just take
smoking
some,
and
like,
drinking
Tylenol
coffee.
PM, like, go to
Yeah.
sleep or something?
But at all the Denny's,
Maybe you should take
there's
anything.
also a bunch of people on, like, meth and so on.
Ooh, watch the S word there, Molly.
Huh?
Molly, you got to just make it through the night. You just got to go to bed.
You only have a 30 milligram dose. You've already taken it. Is that right?
Yeah.
And heroin is your drug of choice?
Yes.
How much are you taking every day?
Like 2 grams.
2 grams a day.
Yeah.
Is that a lot?
That's a fair amount. And when was your last hit?
This morning.
Okay. So
Of heroin?
Heroin, yeah.
Yeah.
And how long ago did you take the methadone?
At like 3 or something, 2
Yeah.
or 3.
Is there... Oh, Christ. I hate methadone.
Well, I'm a big fan of it.
They didn't give you anything else? You have no access to anything else? No.
Well, a hospital a couple nights before gave me, like, clonidine and all that kind of stuff.
Yeah.
Then the people at the methadone place told me not to take those.
What else do you have there? Clonidine, what else?
And like Aerosmith or something.
Lorazepam. Take that.
Yeah.
Okay, take what's the dose you have of that?
I'm not sure. I think it's like...
You could take 1 or 2 milligrams of that tonight. That will help a lot.
Take 1 or 2 milligrams.
1 or 2 milligrams tonight, and that will help you sleep. But that's not something you can take regularly. You're going to like that a lot. So be careful.
Are you at home right now?
Yeah.
Do you have anyone there with you?
Yeah.
Who's there?
My parents.
All right. But they know you're kicking heroin?
Yeah.
All right, good. Take the lorazepam, take 1 or 2 milligrams. That should get you through the night and get a bigger dose tomorrow and push them for something more that gives you better coverage.
Yeah. You masturbate.
But the lorazepam...
That puts you to sleep.
You got that, Molly? That's Adam's solution for everything. I'm going to mention that to my patients on the unit tomorrow morning. That's the first thing I'm going to say when I go march out of the unit.
Hey, as the old Jewish joke goes, it couldn't hoit. I think that's how it goes.
Nice.
All right,
Molly, good luck.
Thank you.
All right, take care of yourself.
Lorazepam, 1 or 2 milligrams, fine.
Yeah.
I think it's really cool when people admit that they have a problem, though. I gotta respect that. When people know they have a problem and are trying to do it.
It's touching, isn't it? I mean, you really feel they suffer.
No,
with it.
I seriously, I'm 19. I know probably a handful of people who have done drugs and are over it. And I know 2 that overdose. I completely respect the people that admit that they have a problem and are trying to take. I mean, I understand it's completely hard, but as long as she does it, I think it's
the hard part is getting really to capitulate to the intensity of treatment they need.
Wouldn't it be better if she's if she's having problems tonight, she should be with someone? Don't you think? Like she should go to her parents and be with them and watch TV around them. So
absolutely.
If she is listening, I don't think she should be in her bedroom by herself.
No.
I think she should take something to help her to sleep through the detox.
That's the lorazepam.
What is like a sleeping pill or something?
Ativan.
Yeah.
But I think, I'm totally against everything, but I just think that maybe she should just go and talk to a friend. I mean, who's not on drugs and just go and...
Well, it's an interesting piece of advice, because that's ultimately what we try to teach addicts to do, is to be able to use their interpersonal experiences, the intersubjective experience, as a way of regulating all the unpleasantness in their head.
Masturbate.
And masturbate.
Masturbate.
That's the new
Go buy
plan.
a vibrator.
That's the new one. We're handing out vibrators tomorrow morning in my unit.
There's going to be a second and a half where she's not thinking about heroin. Do you know what I'm saying when she masturbates?
She may be while she's masturbating, you understand?
Yeah, but when that climax hits, she's not going to be worried
But how
about
old is she?
getting
17.
hit.
She might not be able to climax. Earlier.
She's doing heroin.
So it
I
might
don't
make
think
her a
she'll be
little
able
more
to
aggravated.
climax.
See?
Tire herself out. Go to bed.
But it might make her a little more aggravated that she can't actually climax and therefore
maybe she'll be able to go to bed after.
She was 18, and
18,
she was doing a lot of heroin. She can masturbate.
But as long as she's taking care of it, it's good.
Porno movie.
Methadone, sometimes you can't, though. That's one of the problems with it.
Chris?
Hi, how's it going?
27, what's up?
Not much. Well, I guess it started when I was 5 years old. My dad made me and my sister do it for the first time when I was about 7 years old. After that, we never did it again. My dad passed away, had problems. I knew something was wrong when I was real young. I was like, I was toward girls, I thought it was something different. And then after I grew up, about 18, 19, after me and my sister talked about what happened, I'm 27, I haven't done it yet. Every time I talk to girls, I feel nervous. Then girls I know think I'm so sweet, I'm so nice. I talk to my sister, she says that, she'll wait to the perfect.
All right, well, hold on a second. This is male Chris, yes?
Yes.
The boy.
Chris the boy. And your dad forced you to have sex with your sister?
Sister, when we were young, so about 6 or 7 years old.
6 or 7. And how many times do you think this happened?
Once?
One time.
Once.
All right.
Then after that, I remember.
And then he died.
And then he died.
Well, actually, he killed himself.
Oh.
For other reasons.
That's good.
And then I think I have a flash memory of my mom molesting me.
Right.
When I grew up, I talked to my sister about it. She said yes,
Uh-huh.
that did happen.
And is your sister older or younger?
Younger than I am.
How much younger?
She's 24. She's married. She has a kid already.
Oh, bad times.
Yeah.
And I worry about the guy she married. I truly worry about that guy. But anyway, you're not married.
No, actually, I'm 27, and I'm actually, the girls I know, they say I'm so sweet, so nice.
Chris, stop. Chris, stop. We got all that.
You like the ladies, do you?
Well, I talk to them, and the thing problem is, every time I'm around them, I get nervous. I actually.
Do you like men or you like women?
No, I like girls.
You like girls, right? Are you a virgin? Have you been with?
Yes, he's a virgin.
You are. Okay. All right. So you never had a full-time girlfriend?
No, actually, I never had a girlfriend. All the girls I've known throughout my whole life.
Think you're sweet.
Sweet guy. So you're a nice guy. And ironically, they only have sex with the a-hole, so they got to start thinking you're an a-hole, then you get laid.
No.
What do you do for a living, Chris?
Actually, I'm a part-time. I work part-time, and I go to school part-time.
What do you do at work?
I'm a bagger. I run a store.
Puts hookers in the bags and then throws them in the trunk of his car.
Got it. I got it.
And are you, what are you studying in school?
I'm majoring in art, minor in art history.
Art history.
Yeah.
All right. You want to be a teacher one day or something?
Actually a professor.
Okay. But you're going to junior college?
Yeah, then I'm planning on going up to Sac State in about a year or so.
Okay. About 30 years before you get that degree. So you're working in the union, the baggers union? Oh, that's good. That's decent money. You able to support yourself?
No, actually, I'm living with my stepdad and my mom right now.
Mm-hmm.
They're helping me out.
Yeah, you thinking about moving out, maybe?
Oh, yeah. I would move out, but right now it's the amount of money that it costs to live out here. It's very hard to support yourself.
Right. And are you, have you had any therapy, any counseling for this traumatic childhood you've lived?
Not really. Actually, I remember it, then it kind of like went away for a few years, and all of a sudden it just came back. Over the past 8 years...
Chris.
Oh, whoa.
Sorry.
All right.
Girls think he's sweet.
The girls think he's sweet?
What's that?
Yeah.
Like, he was really sweet.
All right. So Chris, how about maybe a little counseling for this horrible traumatic trauma of a childhood you've had?
Yeah, I guess you're right.
Yeah, that's what you need to do. And you have any friends? You have any buddies?
Yeah, a lot of buddies.
You do? A lot?
Yeah.
Jesus.
So you're social and you get around and you get out?
You have friends at school?
Yeah, I have friends at school, but the problem is, when I'm around girls, I get nervous.
All right. Well, here's the whole deal. Chris, as you know, I'm a genius because I said that 3 calls ago.
Yeah.
Right. So you got to listen to me. Don't worry about the ladies right now. See, guys, they put the cart in front of the horse with the ladies. They're worried about getting the ladies from their parents' living room at age 27, from junior college at age 27.
That's right.
That's not the that's not the direction you need to go. You need to worry about getting out of your parents' house, getting your own place, hanging out with your buddies, getting out of junior college and going to a 4-year school, getting every part of your life moving forward. Every part from working out to getting a decent car to getting out of the house. Now, it's not like women won't date a guy who doesn't drive a sports car, but they have trouble dating guys that are living at home well into their 20s.
27?
That's what you got to focus on. And right now, you don't have a ramp, and there's no ramp good enough to work around you living at home and going to junior college.
Well, the problem is, over the past 8 years, I could have done it 8 times, 8 different girls. For some reason, something's kind of passed something up. I'm sure.
Right. You've been traumatized in the past. You sort of just
you're not steady on your feet.
Yeah.
You got to get on your feet. Don't worry about the women. You worry about work. You worry about saving up some money. You worry about first and last. Yep. Move out of the house. Get the education going. Yeah. Hang out with your buddies.
Everything else will take care of itself.
Oh, man.
Oh, yeah.
Oh, baby.
He'll have a radio show in 10 years.
8 chances in the last 8 years. Not too bad.
Yeah.
Not sure why I didn't capitalize on that. But
he freaks out. It's too traumatic.
Now, shouldn't he like boys or something at this point?
He was traumatized.
What do you say to that when someone's been so, traumatized? What do you do?
We had good times.
Go and masturbate.
I tell him what I told him, which is, and I think we both do, which is don't focus on the area of your life that you don't do very well at. Focus on the other things. Get everything else going. And get the job going. Get the career going. And get the therapy going.
He's never had any sexual experience with a girl? any?
Well, now he's already 27. What can you do to...
Age of 5?
Yeah.
He's...
What can you undo his
no, he's already 27. That would take a lot of...
work.
Yeah.
Mm-hmm.
I think it's worth it.
But does he have any female friends? I know they all think they like him because he's so nice, but does he consider them, do they all hang out? Or does he not? Is he afraid of, talking to girls?
Like you said, he had 8 opportunities, and he couldn't what do you call it?
Close the deal.
Yeah.
So but close the deal doesn't mean that he never had a sexual experience of some sort, though. Does it?
He's all messed up. From when he was little, so I don't even think he could close the deal if he wanted to.
That's right. That's exactly the problem.
All right. Brandon?
Hey, Drew, Adam, love the show.
Thank you.
Laura and Mila, you're so talented. I love that 70s show, one of my favorite shows.
Thank you.
Anyway, my question's for Mila. I just wanted to know how it was working with Aerosmith in the Jaded video. How'd you like that?
It was really, really fun. We did it in about 3 days, and they were extremely nice guys. I met them for only about 40 minutes out of the 3 days, but the time that they come in, they came, and they were really nice because we had I think Cirque du Soleil there, or some kind of circus, and they came and shook hands with everyone. They were really, really, really sweet guys. So they were really fun to work with.
Great, thanks a lot.
Hey, Brandon?
Yeah.
That's it?
Yeah, that's it.
You're good?
All right.
All right.
Bye.
Good times. Yeah.
Go
all right.
masturbate.
Let's take let's take a little break. Let's all just take a breath and be glad that we're not strung out on methadone, or that we never had to have sex with
at the age of 5.
Sisters at 5. Yes.
Yeah.
That's nice.
Yeah. Mm-hmm.
It's good times.
Yeah. So
Amen.
Never had to do any of that.
Had to clean carpets.
Yeah.
It's getting close.
Yeah. I would have had sex with my sister once to avoid cleaning carpets for a year.
Nice.
Would have done it.
Yeah.
Have done it.
Yeah.
And if she was a good sister, she would have agreed to it. I don't want to see you with that wand in your hand, bent over, some red onion at 4 a.m. Yeah. Okay. I'm going to talk to her about that. Mm-hmm. We'll be back after this. Hey, everybody. Loveline. I'm Adam Carolla. That is Dr. Drew. Phone number 1-800-LOVE-191. Mila Kunis and Laura Prepon are both here. I had to go south.
That's fine. Thank you.
All right.
What's up?
Hey, what's up? That 70s show, everybody. Tuesday nights.
Yeah, he plugs at every single commercial break.
That's good. Thanks, Adam.
Yeah, it's my job. That's less talking to the callers. Robert?
Yeah.
You're 20.
Yeah, what's up?
What's up?
Well, it's like this, man. My girl's been out of town for 5 days, and getting a little hot and horny, you know what I mean?
Go masturbate.
Yeah.
Oh, yeah.
Yeah.
So, started experimenting with some different stuff, and came across a bottle of her cocoa butter oil, and it seems to have burnt the hell out of the tip of my wang.
Good times.
So I was wondering, what I could do for that.
Yeah. You know what she may have done? My old lady did that. She put a little drop of acid in all the creams in the house, including the dishwasher.
Is this true?
Yeah. My mom did this too. Yeah, but that's how my dad died, because she did it to the butter.
Oh, accidentally.
Oh, God.
Yeah.
She didn't think you actually might eat the butter.
She found the cube in the room once, and it was still warm.
Can't the guy put aloe vera lotion on it? One that
some like banana boat or something?
Like, is it burning?
It's not burning. It just feels kind of weird. It don't feel right, but it's all wrinkly.
Don't put any more cocoa butter on it.
Yeah.
Yeah.
Get like some of that gel from like Rite Aid, the anti-burning itching
Yeah, you
stuff.
get some Cordate over the counter. That'll take care of it.
Really? On your penis?
Probably will.
What's it, vapor?
The penis look like a matchstick that lit. It's actually ignite at that point.
Laura's advice.
Yeah.
Dip it in
on the tip of it.
You smoking a lot of weed there, Robert?
I just quit.
Yeah, yesterday.
This morning. A few days, like 5 days.
5 days ago. Oh, good time.
Why'd you quit?
I got to get a drug test at a job.
Yep.
Yeah, that's not quitting. That's putting it on
Don't you
hold.
usually ask your friends to pee in a cup or something?
What's that?
No, nice, Laura. Give me some advice.
I'm just going to stop talking. My advice is bad.
Actually, so I think it's pretty legit there.
Where are you working? Where are you trying to get a gig?
The post office.
Really?
They give drug tests at the post office now?
Hold on, they don't hire white people, do they?
What's that?
Las Vegas.
Oh, in Vegas?
Yeah, in Vegas.
I've never seen a white guy behind the counter at the post office, unless it's that sort of just crazy, balding, red-haired guy with the pork chop sideburns, loner guy, super skinny and freaky with the beady eyes.
Is that what you look like?
Not now, but about 20 years of working at the post office, that's what it's going to look like.
Nice. Good advice.
Here's what the post office says. Morbidly obese black folk, and then crazy skinny Ichabod Crane Irish guy with the pork chops and the bald head.
Now you're going to get starting getting phone calls from people from the post office. That's not what I look like.
Oh, is that what a black person sounds like?
Oh, my God.
That wasn't an Irishman.
That was an Irishman.
Wow, true.
My goodness, I'm insulted.
Me too.
I'm shocked at the insensitivity displayed by these young ladies.
Yeah, I guess.
Ladies, please.
Guess that's what.
I was standing up for the post office.
I guess that's what Mila thinks of all black.
Oh my
I hate the post office, so whatever.
Yeah.
I love the post office.
Goodness.
No.
Marianne?
Mila gets injections in her eyeball
I
regularly.
do steroid injections.
In your eyeball?
Yeah, she can show you where they inject.
Yeah, this the white
Wait, it
stuff.
got better because you didn't see it when it was.
Look,
Wait, is this not what we're talking about? This is a month.
I'm taking
I
the
had to
heat
look
off
at
you,
this
Mila.
every day at work for like a week.
Yeah?
Into the eyeball there.
Wait a minute.
It's got. Yeah.
This is like a month into it. You get it done like I have to get next one's November.
How does it? That must feel awful with the needle just going in.
You know what? It's psychologically disturbing. It's not so much like, ow, it's painful. It's more like you're looking this way, so this eye sees the needle going in. I mean, they put so much numbing cream on it that it's not the essential. It's a pressure pain, not a pinching pain. But it's just watching the needle. I mean, listen, if anybody has a problem with anything, like medically, just go get it checked out, because that's where I learned, oh, it's just not good to let it dry.
When we were on the road in Syracuse, I gave Drew a shot in his eyeball.
Did
Remember
you?
that? Drew likes a little jizz humor. Yeah. Remember that?
Yeah, well, I'll never forget it.
Yeah, I told you. I said, leave the glasses on. I like the old doctor thing. He was like, please. Yep.
I want to leave one because I love seeing you enjoy, the reception.
Would you guys like to see my form one more time?
Yeah, sure.
I claim that I'm the #1 receiver of oral sex in terms of form, that my decorum, my etiquette cannot be beat.
But doesn't a girl need to know that you're enjoying it if you just lay there like whatever? She's probably like, what the hell?
I have...
you need to like show something. Like,
I do.
That feels good. Or
at the end, they show
Make a
something.
noise.
That's where I got the shot. See,
At the end, he lets out a little girl like, okay.
No,
that's it.
it's all in what's produced.
Right, right. All right, you ready?
We're ready.
Here's my form.
Action.
Well, it seems to get better and better every
Does that mean
time.
it's good?
Wait a minute. You promised you would not show that. Wait a minute.
Not bad, right? Barely move.
Nice.
I don't do a lot of distracting, like, oh, yeah. I'm not a head grabber, not into
You don't
that.
punch them in the head.
No.
Yeah, you don't want to do the head grabber. That's
not cool.
No, women don't like that.
We got to show something.
No,
the
it's
fact that we
demeaning.
Like it.
No, it's demeaning.
Women find it demeaning.
That's right.
Nice sound effect.
That's right. Every once in a while, when I think you've lost a little enthusiasm, I throw in, oh, yeah. That just keeps going.
That was just so sincere. Let me tell you,
doesn't
that
sound
was
too convincing,
great.
Adam.
You see Adam going, oh, yeah.
Yeah, meanwhile,
No,
he's like watching the football game. He's like, oh, yeah.
And
Like, wait, the Angels are on, honey. Turn on.
Wouldn't be the football game.
once in a while,
Watching a porno.
I toss in a...
But he would be holding the remote like that.
Yes, exactly.
yes, all right. The good times.
Good time.
Marianne,
Hello?
you're 17?
Hi. I've been dyeing my hair for about 1.5 years or 2 years.
Mm-hmm.
And I stopped almost a year ago, but while I was dyeing my hair and steadily since, my hair's been falling out. And I mean, I started with really thick hair, so it's not very noticeable.
Yeah.
And I'm scared that it might start to be noticeable. And all the hair loss treatments I've seen are for hereditary hair loss.
Yeah.
And mostly for guys. And I didn't know if Dr. Drew knew of anything that was out there to.
You can use Rogaine for this kind of thing, but
You picking at yourself? And she seems obsessed with her hair. She's dyeing her hair all the time.
You know what you can do? There's this vitamin called horse, because my sister lived in Japan.
Oh, you told
for
me
4
about
years.
this. Horse something.
Yeah, my sister lived in Japan, and her hair started, because of the diet or something, and then her hair started thinning and stuff, and she started taking this vitamin called horsetail, and in like a year, it was like fully like strong. And oh yeah, I take it every day.
It's just like an over-the-counter like.
It's just like a vitamin.
My understanding with the hair dyeing, though, is the hair just splits off. It's not that it's falling out of the fall.
Yeah, but when it grows back, it'll be healthy with like. That's just. I mean, I know the horsetail works.
Did you bleach it or just dye it?
I just dyed it.
But what is it? Horsetail is a kind of herb that they call horsetail?
Is it?
It's called horsetail, but it's really good because I mean I saw what happened.
Could it be malnutrition instead of dyeing the hair? Like, is she getting? I mean, literally, is she getting her vitamins? Just a hair dye?
Just you can.
Well, hair dye is so it dries out your hair.
I know,
it's
but
really
it doesn't.
bad.
No, only if you bleach it, then your hair can
Then
fall
it breaks
out.
off, but you can actually
Yeah.
any chemical in your hair and the hair can start falling
Just
out.
cut off the split ends and stop dyeing your hair, and it should grow back strong. And take horsetail.
But see, I haven't dyed it for like a year, and it's not like split ends.
It's just falling out. Okay.
falling out.
Are you having Are you on any medication?
None at all.
Birth control pills? Nothing.
Nothing.
You have no herbs, nothing over the counter. Have you developed any other symptoms besides the hair loss?
No, that's it.
You don't pick it yourself?
No.
And is it in a particular area, or is it diffuse throughout your scalp?
No, it's just like it falls out that like in the shower
Everywhere.
or anywhere.
And you've not been pregnant or anything like that recently?
No.
You've not been through any kind of like car accident or trauma?
Nothing.
Do you got eating disorder?
No.
Your nutrition's normal?
Yeah, I guess.
See, what did I say? It's not I'm telling you, dyeing your hair will not make it fall out, so you bleach it constantly.
Yeah.
But I wasn't bleaching it though.
Right, so it's something else.
What about your nutrition?
Hold on. Yeah, you're always right, Neil. Exactly. That's exactly what I wasn't saying. You see? I'm right about being wrong.
What about nutrition? What's going on with your nutrition?
I eat normally. I haven't changed my diet.
All right, then go to. She gotta go to a doctor.
Dermatologist. All right.
No, they have guys who specialize in this.
Eat broccoli.
Well,
that's got to be scary.
Not dermatologists. They're guys who specialize in the whole hair thing.
Yeah.
Well, hair replacement. That's different.
No, they analyze and they do the whole thing. They put the scope on your head and they can. Have you ever seen this?
No.
And it was a man show bit. They take this scope and they run along your head and it's enlarged 1,000%. You can see it on the TV. You can see the thin. You can see the thick. They have specialists.
What
who do
about
this
using
stuff.
Rogaine?
Rogaine will help her, regardless what the cause is.
Go see a specialist. You might have an idea. All right, let's talk to Tiffany, who's 18. Tiffany?
Yeah. Hi,
What's up?
guys. I just had a few questions and comments about that 70s show.
All right.
Okay.
Okay. First, I wanted to ask Laura if Topher is a good kisser.
Oh my God. Sure. Yeah. Well, we kiss so much. Mila's over here like cracking up. We kiss so much now on the show. Whatever. We kiss so much on the show that now it's just like not even. We're just like, oh, we have to make out in the scene. All right, let's go. It's not even because we're such good friends that it's just like not even a big deal.
Oh, that's cool.
So we don't really think this is a good kisser or this isn't a good kisser. We just kind of like, we literally make out every week, so it's not even a big deal.
You use your tongues?
No, he tries to slip it in there every once in a while.
See what I'm saying?
No, I'm just joking. But we're very professional, and we're like best friends, so it's not even a big deal.
Oh, does he have a girlfriend?
What do you think, Mila?
She killed her. Laura killed her.
Yeah, in a jealous rage.
Does he ever?
No, I don't think he does have a girlfriend right now.
Does he ever get an erection when he's making out?
I don't think so. No, because when you're in front of the cameras with the audience, I think guys are too nervous to like get an erection.
Well, what about porn movies? There's a camera there.
Well, are there cameras, and like 100 people in the audience watching you?
If you do one of those gangbang films.
Well, you said you've been in the room where they're filming those porn. There's like 40 guys hanging out.
Yeah, worse than 100 guys. There's one guy in cutoffs with duct tape hanging from his belt who's talking.
Oh, dude.
Yeah.
Ever.
All right, Tiffany.
Yeah.
They're good times, right?
Yeah.
I've taught it.
All right, settle down, you two. What do you think, this is a slumber party? Jesus Christ.
I just had a few more comments. I just want to let everybody out there listening know that Laura and Mila and like the whole cast are really genuinely nice people. I've met you guys like twice. I saw the taping of the show.
Thank you.
Yeah, and Mila, you lied to me because I really wanted to meet Topher, and he was like driving away, and I asked you if it was him, and you're like, no, and it ended up being him.
I try to keep his life safe. I don't know. I didn't know. What am I going to do? Go find him.
Crazy broad following him home. Who cares? No, you did the right thing.
I don't know. I apologize for lying to you.
We have met most of the cast, and they are really nice people, right? Fun and nice.
Thanks.
Think about it.
Thank you.
Yeah.
Well, if anyone starts getting a big head, we all just we're like, that's not going to happen, and that's not going to fly. So we're all really keep each other in check, and that's why we still are really close.
Well, I think it's because everybody started off really young and kind of
Yeah, we didn't really know anything about the business.
Man, I don't know, though. They're starting off young and doing it, and, you've had success for 4 or 5 years now. You could be a-holes by now.
No, because when everybody starts...
By now, but we're not yet, I'd like to think.
That's the point.
Yeah.
The compliment he's giving you.
Yeah, thank you.
Thanks. You should be a-holes. That's what I'm saying.
Thank you.
I apologize for not being an asshole.
Drew, what keeps you grounded? Just your wretched self-esteem?
Very wretched self-esteem.
Multiple family system? Domineering mother?
And my insanely busy schedule. Life.
Tell you what keeps me grounded.
Yeah.
My position for taking oral. I focus so much on my form.
Well, knowing that you're at the top of the heap, that you're the one. You're the one they're gunning for.
The only way to stay on the top of that heap is to focus 24/7 on it. All right, we're gonna take a break. I'm gonna work on my form during the break, and we'll be back.
Loveline. Going to join us, Adam?
No.
You have to say the number.
I'm sleeping.
Call 1-800-LOVE-something.
LOVE10. We were just talking about the fact that you get these injections in your eye for the iritis.
Yes.
Can be a sign of Reiter syndrome. And one of the Reiter syndrome, that's why you get those x-rays of your pelvis.
Okay.
One of the classic signs of that is inflammation of the Achilles tendon. And you were just pointing at your...
Yeah, I think it's just the shoe, though. I think the shoe rubbed it in a weird...
I think it's his blister.
That's what I'm thinking. Please, I had so many tests done on what to find out was wrong with me, and I think initially it's just in my blood. I think that's all they found.
It's just your eye.
It's just my damn eye.
That 70s show.
All right, you ready to go to the phones?
Ready to go.
Let's talk to David. David
hung up.
Hello?
You're 25. What's up?
Yeah, I'm 25, and I'm gay, and...
You're gay. Man, go ahead.
I said that.
And I always go after, younger guys, and it's, I don't know, it's just messed up.
How young?
The last two were 19.
At least they're legal.
And how old are you?
25.
I'm 25.
What's the youngest?
That I look at?
Yeah.
16.
Okay.
Yeah, well, at least that he looks at.
But is that sort of where your attractions lie?
Yeah, and nothing's ever going to come of that, and I want to change that, but
there doesn't seem to be anything I
Well,
can
what's the problem with 19-year-olds? You're 25. What's the big deal?
Well, they
Date a 19-year-old guy.
They either just use me, or they're not interested, or and they're not. I mean, they're 19. I can't have anything with someone.
Well, a common reason that people get focused on young folks is theoretically an attempt to sort of retrieve some broken aspect of yourself. So were you sexually abused at a young age?
No.
Nothing like that ever happened to you? No trauma?
No.
All right. Well, there's a big problem with 19-year-olds. They're inherently flawed, the gay ones. How does this work? You think it'd be a utopia if you were dating guys that were 23 or 24?
They're just immature.
Well, are you looking for a relationship, or are you looking for a fling?
Well, ultimately a relationship.
All right, so date a guy who's 24.
I'm never attracted to guys that are 24.
What's a big difference between a 19-year-old and a 24-year-old anyway? About 5 pubes and 3 pounds?
And can't you
What's up with you gay guys?
That look younger, and there can be older
Well, are
guys
you
that
attracted
look
physically to a younger guy or mentally? What's the attraction of a 19-year-old? Physically. I know tons of 24-year-old gay guys who look like they're 16, 17.
Why don't you hook them up?
Please, y'all live in West Hollywood. It's not that hard to find them.
He's in Portland.
Never mind.
Then
Just
that's the
kidding.
problem.
Yeah, listen, gay guys look like they're 16 when they're 47. They with the exfoliation and all the creams and the sunscreen. These people take care of themselves. They shine. They're like new dimes, these gays. And they're beautiful. What are you talking about? Can't find a 24-year-old that looks like he's 19 or 20? You don't want a relationship, David. Something's up.
Yeah,
What's wrong with you?
Why do I not believe you?
I don't believe it. Yeah. What happened to you? What turned you gay?
Nothing turned me gay.
Nothing?
I want to be gay.
Have you ever had a female experience?
Yes.
Yeah. Not good?
What's your term? Close the deal?
Close the deal.
I closed the deal.
Just not your thing.
Oh.
I was 17. Yeah.
But you closed the deal, so you were able to get it up and enjoy it?
How old were you when you first were the male?
Like, let's see, like full-blown sex or just
No, just anything.
I was 16.
Mm-hmm. How about your mom? How is she?
I don't talk to my parents anymore, really.
How come? Well,
yeah. What's up with mom? Domineering? Loudmouth?
Well, when I told my parents I was gay, it didn't go over well. So.
Yeah.
How old were you when you did that?
I was 20.
And what is it about your parents that they couldn't handle that?
I don't know. They're not religious or anything. They freaked.
What kind of woman is your mom?
You keep going back to that.
Yeah, I want to know.
I mean, I don't know. She was a house mom, growing up.
Loudmouth or quiet?
Average.
All right. You're gay. You're biologically gay. We all believe you. And now you just got to find yourself a nice 25-year-old guy who looks like he's 19.
Yeah. But 25 and 19 just doesn't sound like it's that big of a gap.
It isn't. David, this isn't a problem. You have overall relationship problems, but it's not an age thing. All right?
Okay.
Yeah, all right. What do you do? Do you work somewhere?
Well, I have 2 jobs. I work part-time as a security guard, and I do credit card customer service on the telephone.
All right, be a nice guy at work.
Okay.
All right. Now, listen, David, whatever's up with you, it needs to be sorted out. It has zero to do with the age thing.
Yeah.
And I don't know what he wants us to tell him.
You're gay.
All 19-year-olds are flawed. You can't have a relationship with them.
No, do you want to take this one?
There's a million 19-year-old guys in relationships. All right. Jacob.
Yeah.
You're 14?
Yeah.
What's up?
All right, I was skating like a week ago, and I hit my nuts on a rail. Well, it was like not my nuts, but like the bone under my nuts.
The bone under your nuts?
Yeah, and it's like really...
Cervix? Wait, that's not...
Perineum.
Oh.
I guess.
Is that the taint?
I don't think guys have a cervix.
Right. Just making sure.
All right. Yeah?
And I want to know, like, what can I do? Because it happened before, because I, like, played baseball when I was, like, 10. And they had to take me to a doctor, and that was pretty embarrassing. They had to, like, look at my nuts and crap. But it's not my nuts. It's, like, under, and when I can't even walk anymore, it, like, hurts really bad.
Probably because you're healing, because that's a pretty brutal fall.
But here's the problem, though. They got to get past your nuts to get to that bone, right?
Yeah.
To get to that area.
It's not really a bone back there, Jacob. It's part of the problem. And there's a lot of machinery, a lot of tubing and things that can go sort of wrong.
Oh, my God. You screwballs riding those handrails, doing those grinders. It's crazy.
Have you ever
How
seen
high are you
Jackass?
guys?
They do crazy. You don't want to go there.
Oh, my God. You should be wearing a cup. Are you wearing a cup?
No, it bothers you. You can't even skate. Right?
Maybe you should wear a cup and be safe.
It's ridiculous. Hold on a second. I played 11 years of football with a cup. You know what I mean? Walter Payton rushed for 17,000 yards with a cup on. You could get high and jump on a rail on your crappy skateboard with a cup on.
Wouldn't have protected his perineum, though, his taint.
It wouldn't?
And it doesn't go way up under like that.
Yeah, it wouldn't. But, you know, they're cups used by martial artists, kickboxing cups that do curl under.
Way under like that?
Yeah. Yeah. A guy's kickbox 10 rounds with a cup on. Don't
But
tell
if
me you
you're
couldn't ride a
falling
skateboard.
down on a
Wouldn't that hurt still?
rail,
Yeah.
I don't know if that would help too much.
It would just push the cup up inside.
Yeah, that would be even worse.
Okay, so just never wear a cup.
No, I think the cup would protect your nut.
No, just stop skating those rails.
Yeah, but he's not going to do that. Jacob?
Yeah.
Have you learned your lesson? You going to stop skating the rails?
No.
No. He's like,
Does it hurt when you pee? Oh, Mom's in there.
No, he needs to listen to the radio. All right, listen, go to the doctor. We don't care. Well, what is up?
We don't
I hate teenage boys. I can't. If I have a son and
In the
on
bubble?
his 13th birthday, no, I freeze him.
If he's in the bubble, he won't need to wear a cup.
We just send him away.
No, because I don't want him
He'd be in a bubble,
torturing.
he
I don't want him
can't travel.
torturing other people. I'm going to just freeze him like Disney.
At 13.
Yeah, and I'll thaw him out 5-8 years later.
Nice.
Yeah.
He'll still be 13.
Yeah.
Still be just much of a pain in the ass.
But his license will say that he's 19.
Oh, I see. I see.
So you want me responsible for him? Is that what the problem is?
I can't stand 14-year-old boys anymore.
You were 14. What's your problem?
I was a prince.
Oh, I'm sure. I could tell.
Adam was a saint.
You were something started with a PR, but it wasn't Prince.
Oh, Drew saying I was priceless. That's what I love about him. Hey, you're a prick. I just can't. Every goddamn 14-year-old that calls the show acts like we called them at home. What? Yeah, what happened? They tell us half a story, and then we have to fill in all the blanks.
Probably high.
Because you know what? Because they're stupid and they're angry, and they got so much bravado and attitude at 14. Because when puberty kicks in for male, you have to become like five guys instead of the half
When
guy
you're
that you
14,
really
you
are.
think you know everything.
You
It's a
squirrely little wussies with your
storm.
zits and your bad teenage mustache and your knobby knees, you pussies. Stop calling this
And
show.
your bruised taints. Stop
Your
calling.
bruised taints and teenage mustaches. How dare you call this show and interrupt it with your crazy problems? And they'll never not do whatever they did to hurt themselves in the first place. It's like, you're going to have to put that skateboard away. Idiots. Go ahead.
They'll learn their lessons sooner.
No, I hope you guys all do grinders on your sacks and you can never have kids. You're rendered sterile. Sterile, so we won't have to deal with your offspring.
Nice.
Thank you. We'll be back. All right, I want to thank Mila and Laura for coming in from That 70s Show.
Thanks for having us.
Thanks for coming. Anytime, lady.
Thank you.
Thank you for the applause.
That 70s Show Tuesday nights. Fox, 8 o'clock. Keep watching it. And syndicated, well, in on a station near you. You can just look that up. So, until next time, this is Adam Carolla for Dr. Drew saying mahalo.
A little hot and horny, you know what I mean?
Don't masturbate.
This has been Loveline. The opinions expressed on this show are not necessarily those of the staff, management, sponsors, or this station. The producer for Loveline is Ann Wilkins Ingold. Loveline is a presentation of Westwood One Entertainment.